Hello everyone. Today's topic is dementia. The pieces of information provided here will help you understand your patients with dementia, increase their engagement in functional activities, and improve overall outcome. Dementia is a term used to describe a group of conditions that affects cognitive functions and leads to memory loss. It is a progressive neurological disorder. Dementia is caused by deposition of protein named amyloid in and around the brain cells. Dementia is commonly used for Alzheimer's disease. The symptoms of dementia may vary depending on the stage, early, intermediate, or late stage. Here are some signs of early dementia. Repetition is the first early sign. You will see the person repeating same question or phrase every few minutes. They might ask you, "How is the weather outside?" and you answer them. In few minutes, they will ask you the same question again. They won't remember what answer you gave. You might see signs of behavior changes such as anger, agitation, depression. There may be episodes of confusion. They don't know what they are doing or where they are. Signs of forgetfulness. They might not remember where they kept their cell phone or keys or where they usually put their spoons and forks. They would have difficulty solving simple problems, performing familiar tasks such as cooking their favorite dish or brushing their teeth. You will see them isolating from the outside world. They'll try to stay inside the house most of the times. Here are some facts. This population would have short-term memory impairments. Remember, long-term memory is still preserved. If you ask them what they had for breakfast this morning, they might not remember. But if you ask them something that happened few years ago, they would provide you precise details. They have difficulty dealing with changes, following instructions. It's hard for them to learn new things. You will see signs of anger or agitation when they are dealing with changes in caregivers or therapists or techniques. They would have increased processing time and increased reaction time. If you tell them something, it might take few seconds for their brain to register their instructions. They might take longer time to stand up from a seated position following the instruction. It's hard for them to express themselves, so it's important for you to understand the source of their discomfort or their pain. It's hard for them to concentrate. Their attention span is limited. Here are some tips to increase engagement in this population. Call them by their name. Look into their eyes with a smiling face and speak in a low tone. Have consistency with caregivers, therapists, and healthcare professionals. Try to establish a routine. If they are used to reading books before lunch or taking therapy at a certain time, keep that time consistent. Do not disrupt their routine. Provide them simple one-step directions that are easy to follow. Take them to a separate, quiet room to increase their engagement and improve their attention. This population responds better with visual cues than verbal instructions. If you want them to do a certain activity in a certain way, demonstrate it first and let them copy you. You will see better carryover. Engage them in familiar tasks. Ask their family members what they used to do before, which activities they enjoyed, and try to incorporate them in your session to increase participation. Try these tips to deal with behavior changes. Admit to what they say, even if you know that the information they are providing is incomplete or incorrect. Understand the source of their pain or discomfort. Most caregivers report patients having difficulty taking showers. Try to find out what is the source of their discomfort. If it's a dignity issue, the temperature of the water, or discomfort just getting in and out of the tub. Provide them opportunities to participate. After providing any instruction, wait for a few seconds. Let their brain register the instructions and respond to it. Always use affirmative statements. For example, if you see them dragging their feet while walking, instead of saying, "Do not drag your feet," use the statement, "Try to lift your feet high enough to clear the floor." If you see they are getting agitated with something, try to redirect them. Redirection always helps to calm them down, and then introduce the same topic a few minutes later. Keep them active. Engage them in activities that involves memory cell stimulation and to keep the cells alive. The activities depends on the stage of dementia. Playing cards, Sudoku, crossword puzzles, word search, these are some of the examples of the games that stimulate brain cells and involves higher cognitive functions. I hope you find this information helpful. Please leave your questions and feedback in the comment section below. Thank you for watching.